Thank you, Mayor Spiegel and members of the council. I think the last time I was here, we discussed the construction project of the hospital, and there was a lot of questions. And first of all, I'd like to say thank you to all of you for your support in getting where we were today. Mayor Spiegel, you've been a champion since day one. I think Councilman Scott, we met the first week I started working at Corona, and I committed to you that we would do something special this year. And as I said at the press conference today, it was like living life on a razor blade because I committed to doing something that I wasn't sure I could get done. But we got it done today. So the first thing that we did today is we had a press conference, and I'll do the easy one first. We announced a comprehensive academic affiliation with UC Irvine, which is the predominant academic medical program in Orange County. It houses the Chao Comprehensive Cancer Center, which is one of 41 comprehensive cancer centers in the United States. They have over 100 physicians that are listed as the best doctors in America. What does this really mean to Corona? It starts out in December with a comprehensive stroke program that will tie us to UC Irvine. So when anybody who comes in with symptoms of a stroke, we know that minutes count, and the longer that they're not treated and the longer that they're not diagnosed, the higher degree of brain that dies as a result of lack of blood flow or infarction. So we will be tied directly to UC Irvine with what they call telestroke. So when a patient comes into our ER, within minutes, we'll be in touch with UC Irvine. We'll be able to diagnose them and treat them. And if they can be treated locally, if they can't be treated locally, they can be transferred immediately to UC Irvine. We saw this in action last week. We had a patient come into our hospital that had a stroke, a young patient, 32 years old. Patient was in pretty rough shape. We transferred the patient to UCI. They went directly to the operating room, and that patient's been released with minimal stroke problems. So that's the first thing that will happen. The second thing that happens is a maternal fetal medicine program. So this is for high-risk pregnancies. Currently, there's one perinatologist that services the entire Inland Empire from the far reaches of Riverside County to San Bernardino County. And so high-risk pregnancies are often treated by primary obstetrician gynecologists, and then when the babies have to be delivered, they're usually delivered in hospitals that have NICUs. We will have maternal fetal medicine on site in Corona. UCI will staff the clinic and put their perinatologists here. And as part of this venture, we are going to develop a joint venture neonatal intensive care unit at Corona Regional. So that will take place over the next, hopefully, year to have the NICU, but maternal fetal medicine will start right away. The other exciting portion of this is a primary care program. We're looking for office space here in the Corona market where we can place a comprehensive primary care center. And what it'll be University of California Health, a partnership between Corona Regional Medical Center and UCI, academic medicine in your community. And this will take the level of medicine way up the scale here and off the charts. We know that a lot of patients leave the Corona market and go to UC Irvine. They go to Orange County for their medicine. We're going to bring that medicine to the residents of Corona, Eastvale, Norco, and Western Riverside County. The most exciting part of this is patients leave this market for cancer care. They either go to Hoag or UCI in Orange County. They go to the Norris Cancer Center in LA, which is a hike at any time. They go to Loma Linda, or they go into Duarte to City of Hope. We're going to bring the Chao Cancer Center, an affiliate of the Cancer Center, a satellite to the Corona market. So we'll have a comprehensive cancer center in Corona. It'll have access to the UCI physicians. It'll have radiation therapy. It'll have medical oncology. And most important to the people that live in Corona, you'll now have access to 140 clinical trials nationwide. You can't get that unless you leave the market. So this is a very big thing for Corona. It's probably the biggest thing in healthcare that'll hit this market. I would challenge any healthcare system in the region to try to compete with this. It's big, and we worked very hard to get it. Terry Belmont, who's the CEO at UC Irvine, and I are long friends. He actually gave me my first job in healthcare back in 1979. So we worked together on this. The team at Corona has been working literally every day to get this done, and we're very pleased to present it to the community. The second thing, I guess this slide thing can go up. We got approval to start the project of rebuilding and changing Corona Regional Medical Center. I lovingly have referred to the current hospital. We've done a lot of fix-up. We've replaced a lot of the rooms. We've painted. We've put up new flat panel TVs in every room, put up new patient wardrobes. We've really redone the rooms and made the hospital much more presentable. But without an infusion of capital and commitment from Universal Health Systems, it's like trying to put lipstick on a pig. And I've said that publicly. I've said it at UHS. And I literally went to war to get this project done. So this is a domino. The dominoes started today. The dominoes fall. They start today. The first step is the construction of a new emergency room. The current emergency room is 5,400 square feet. We see almost 46,000 patients a year in that emergency room. This new emergency room that's pictured here, this is the artist rendering, this architectural drawing. It will be approximately 20,000 square feet, the base. So where we have 16 beds now that are separated by a paper cloth curtain, we'll have private little cubicles, and we'll go from 16 to at least 26 beds, which will increase the capacity significantly. And then we'll have an additional area for rapid medical evaluation. So these are the sniffles and the sore throats. We don't have to run them through the bed system. There'll be a separate area for them. There'll be a separate entrance for the ambulances to arrive, and there'll be a separate area for the patients that walk in to arrive, and a separate parking area for that. The second floor is going to be shelled initially while the ER is being built, and that shelled space leads the way for an additional 30 private rooms. The goal in the future is to have all private rooms in the hospital. So these are little dominoes that will fall, but they'll fall fairly rapidly if you look at the 20-year history of not having anything done. Over the next 24 to probably 22 to 24 months, this project will come full circle and be at least complete in the phase one. So I define it as phase one is the ER construction, and that includes all of the associated street widening, the closure of Bell Street, all the changes that need to take place to accommodate it. The second step is the shelling of the rooms above it. That'll occur simultaneously, and that'll be followed closely by the closing in those rooms and creating the 30 private rooms. Right now the hospital has no private rooms. There's a rendering there that shows a medical office building. We've got a number of developers that have contacted us about a joint venture of that space. It was originally spec'd out as a 120,000 square foot medical office building. It's way too large to serve what we need to have done. We were going to put the cancer center in that building. We now are going to put that somewhere on the 91 freeway and reach out into the entire Riverside County market. So that will be probably down near where the monster buildings are. That's where we're looking to put it. So we'll probably have about a 50 to 60,000 square foot medical office building. And then that leads to the question of the parking structure. And we'll cross that bridge as we go forward and find out how much parking we really need after the construction of the MOB. The MOB, or the medical office building, could occur simultaneously with the ER construction as soon as we come to terms with the developer. And so essentially we'll own the land, they'll put up the building. So that's phase one and sort of phase two. Phase three is once we get the private rooms done on the second floor above the emergency room, we believe that with the UCI affiliation, we believe that with the continued growth in the market, that UHS will go forward even further and build a second tower. And that second tower is spec'd out, I think, for 5 stories with all new operating rooms. All of this has to occur by state law. SB 1953 requires all hospitals to be seismically compliant by the year 2030. Now, there's no way we're going to wait to 2030 to do a second tower. We believe we'll fill this up within the next 24 to 26 months. The hospital's already at capacity as we sit here today. We've made tremendous strides in changing the image of the hospital. We have brought in, we have no more traveling nurses for the most part. We have 1 or 2. We have very few, if any, registry nurses. We've hired new staff. We've hired new graduate nurses. So it's all Corona staff. And I think when I talked to you before, I said, if you don't have your own nurses, if you don't have your own employees, they're not invested in the community and they're not invested in the product. So we've changed that. And our goal is not to be mediocre, not to be the hospital that we refer to as lipstick on a pig. We want to be the top healthcare provider in the region. And make no mistake, we are here to compete and we are here to get this done. And I believe we have the team to do that. Any questions?
Mr. Haley?
I do. Congratulations on the UCI affiliation. When will the cancer, did you say the cancer unit will be off the 91 freeway? So that's still a few years down the road?
No, as we did this affiliation agreement, we put timelines, hard timelines on the actual affiliation agreement. For example, the stroke program, December of 2014. Maternal fetal medicine, February 2015. Cancer Center, July 2015. So we're going to rapidly move toward this. This will be a joint venture between Corona and UCI. So for example, the building, the lease will be a shared lease. The equipment will be shared cost. It's a very aggressive plan. So it will move quick.
Wonderful. So if a person should need a chemotherapy here in Corona, they wouldn't have to drive to UCI. You could do it here.
They could do it here.
Thank you.
Mr. Scott?
Are there other partnerships with UCI in a hospital, or are we the only one now?
In this region, we are the only one. And just to be fair, what we did is we spoke to USC. We had significant discussions with them. I know all of you were very concerned about how slow this process moved to get this building done. I couldn't get return phone calls most of the time from USC. It's a very slow process. We talked to UCR. We felt that UCR, their residency program is in the infancy stage. It's going to take 5 to 7 years to mature. We felt that UCI was the best for this, for Corona. And really, we're the only place that has a comprehensive academic affiliation.
That's fantastic, and congratulations on moving forward in both realms, the partnership and now moving forward with the build of Phase 1 and Phase 1A or B.
And just so you know, nothing's going to back me off. I'm going to continue. I know when I said I was going to do it, there was like, yeah, right. The doctors actually said, we've heard the same words come out of other people's mouths for the last 5 to 10 years, and nothing ever happened. I take that as a challenge, you know, and so we will continue to move forward. There's no quit in us.
I know you heard it from Mayor Spiegel and myself at that meeting you referenced, and a few other times over the course of the year. So it's a positive thing for our community. Thank you to you and your staff.
Thank you so much.
And as you've heard from me constantly, this is something so long awaited. I'm so ecstatic over this. I don't know if the residents understand how significant this is and how much the commitment. And we get people said today, well, is it really going to happen? I don't think UCI would have publicly done a press conference if they weren't going to fulfill this. Their reputation would be just totally gone to step up and do something of this magnitude, as well as UHS, with committing the $30+ million to start the first ER portion. So I'm ecstatic. As the words I keep saying is, we deserve this. This community deserves it. the health care in our community, the ability to have the facilities as well as quality health care. And so it's been a long time coming, and it's about time, and I'm excited. So thank you for making good on your word, your leadership, and bringing this forward and delivering.
Thank you.